We say palliative care needs a rebrand because when people think palliative care, they're like, oh, hospice, they gonna die. And it's like, no, palliative care is so inclusive of so many different things. I am Dr. Danielle McCamey. I am the founder, CEO, president of DNPs of Color. We are concluding our first conference, Care Beyond Cure, primary care program.
Palliative care is specialized medical care for people with a serious illness. It focuses on providing relief from the symptoms, pain, and the stress of a serious illness. The goal is to improve the quality of life for both the patient and their family.
We don't get access for palliative care, especially in communities of color. So for us, it was incredibly important to focus in on communities of color for this program because
the population that we care for, the marginalized population, often have a limited access to care. So it's important to do this work to expand the knowledge of managing symptoms in serious illness in the general population, but especially having that nuance of care in marginalized populations.
We had speakers that were knowledgeable on introducing palliative care, communication skills that even the novice nurse can utilize to engage with patients and families. Our breakout session, amazing moment where we had people role plays of either the provider, the nurse, the patient, or the family. Everyone in the community should know how to deliver primary palliative care. Our patients deserve nothing less.
My story started probably about 3 or 4 years ago when an aunt who had no children, unmarried, was in a medical crisis. She had AFib, and palliative care was offered to my family, and many family members were involved, but we had no knowledge of it. And this has given me some tools that I really would have appreciated having before that situation.
So that's why it's so important that we look at these things and we ask questions and we say, you know, are they being difficult or is the situation difficult?
We added
for
in
them?
some role play experiences so that people get to use their acting skills, but really make some of the conversations real so that gives people that active engagement to be able to understand like how we navigate certain experiences when loved ones are experiencing critical serious illness or moving toward end of life.
The best thing about this conference is the committee. They are all subject matter experts from across the country who have gotten together and put their knowledge, skill, and ability into this conference, but also into a programming on palliative care so that when people leave here, they can go to our website and take the courses that will give them more information, more knowledge on palliative care.
I invite folks to join us here next year because we will be back, and just excited for this opportunity to actually see the vision manifest after 2 years of lots of hard work and an amazing team that put it together.